I'm pleased to introduce to you Victoria Warnes-Elgie. And Victoria is a SCAD patient. She's helped us with a lot of awareness activities in the past. And earlier this year, she helped us to create a cardiac rehabilitation survey. And she's been doing lots of work analysing the results. So I'm happy to say that she's going to present some of the findings now.
Thank you, Bex. Good morning, everybody. Well, firstly, a big thank you to everyone that completed our survey. In fact, 242 of you completed it from around the UK, which is just fantastic. And another big thank you to our Beat SCAD trustees in helping get the survey off the ground, particularly to Harriet and Karen in the help with the analysis. So with around 40 questions, we know that it wasn't the quickest survey, and we really appreciate your detailed responses, as it's given us great insight into each of your individual experiences, as well as giving us lots of ideas that we can take forward as to how we can improve the rehab experience, with the ultimate objective of this project being that we get more SCAD patients signed up to rehab and, importantly, completing the programme in its entirety. Next slide, please, Harriet. And why? Well, because we know that when heart patients attend and complete cardiac rehab programmes, they have better long-term outcomes, both physically and mentally. Many SCAD patients have a very good experience of cardiac rehab, and indeed our own survey tells us this. 69% of us completed cardiac rehab, 50% felt physically and mentally stronger, and 67% would recommend it. And this is why it's so crucial that SCAD patients attend and have access to cardiac rehabilitation programmes, and also why it's vital that we help work on getting SCAD patients to attend and complete it. So what did our survey tell us about our individual experiences? Next slide, please. Well, I never thought that the Nolans would feature as part of this survey, but I think this quote really brings some of our collective experiences to life and will probably resonate with some of you here. When sessions are heavily geared to patients with traditional heart disease, it can leave SCAD patients feeling confused, embarrassed even, as they're spoken to about leading a healthier lifestyle, with talks on diet, becoming more active, giving up smoking, things that can feel alien to some SCAD patients. Our data revealed that 34% of us would like to see a greater understanding of SCAD as a condition, and 21% a more personalised programme, and 15% a more talking therapy to really build into that complete recovery of both physical and mental health. So in summary here, a more tailored programme would likely not just increase uptake, but keep us there to complete the whole programme, and that's when we feel the real benefits. Next slide, please. As well as a more tailored programme, our survey also revealed a Needful Conditions to sense check their approach when introducing and settling a SCAD patient into the group, because the majority of our patients are female, as we've heard, yet in a cardiac rehab setting, they can find themselves significantly in the minority. And taking this on board, as well as the fact that they can find themselves in a programme designed for traditional heart disease, some of our SCAD patients have felt a real sense of isolation. And what your thoughts and suggestions have told us is that this could be very easily remedied if perhaps SCAD patients could be asked if they would like their condition introduced to the group. A simple tweak like this could make all the difference. Next slide, please. In terms of accessibility, a really good news story here. A whopping 90% said that both time and place were convenient, which is great news. And really interestingly, there was almost an even mix of those that had attended cardiac rehab in hospital settings as those that attended locally in gyms, leisure centres and village halls. But there's always room for improvement. And one of the reoccurring themes on feedback here was that childcare and paid leave would be a very helpful addition to those attending. We're particularly interested in gaining some more feedback in our next survey on those that have attended online cardiac rehab programmes. For obvious reasons, this will be a really important option for many during this time, and going forward could improve accessibility even further. Next slide, please. So of course you'd expect regional variations, and it was really interesting to see what's happening regionally and where perhaps we could take some learnings from regions that are getting aspects of cardiac rehab really right for SCAD patients. Next slide, please. Overall, Welsh patients seemed most satisfied across all areas of cardiac rehab, with 100% of respondents being offered rehab and attending, and 50% saying it was hugely important in their recovery. Scottish respondents report one of the lowest responses for those offered cardiac rehab, attending and completing. And these patients also amongst the least likely to complete the programme, which suggests that they experience low levels of tailored programmes. The East of England registered the highest level of benefit from cardiac rehab, followed by the East Midlands, East Mids, East of England, North East regions, along with Wales. All reported more than 50% of clinical rehab nurses knowing what SCAD was. Southwest respondents reported the lowest levels of cardiac rehab programmes being tailored to their needs. Next slide, please. The regions doing the best at getting SCAD literature to patients are the East of England, North West, West Mids and Wales, but there's always still more work to be done. And giving verbal direction on how to find out more info on SCAD seems to be getting much better, which is great news. It's more prevalent across more regions, with 7 out of 11 regions reporting better than average levels. All regions reported low levels of SCAD being explained to other patients. Again, much work to be done at this level. So I hope that's given you all a flavour of the key themes emerging here. What we're now working on is translating all this insight with our cardiac rehab experts and clinicians into actionable tools and techniques to improve the rehab experience for SCAD patients, and then communicating this to all relevant parties. So there'll be plenty of updates to follow. Please watch this space. In the meantime, if you have recently experienced SCAD, please do ask your doctor or cardiologist about attending cardiac rehab. And if you're ever unsure of how to access it, or you're having trouble attending a suitable rehab programme, we really are here to help you. So please do contact us at Beat SCAD and one of us will be in touch to help. Thanks, everybody.
Oh, thanks, Victoria. That was brilliant. Thank you. We really appreciate all your efforts on the project.